many people actually have to work every single day to win their daily bread.
COVID-19 is overwhelming the world's wealthiest countries. So how will the poorest cope? With over 2 million confirmed COVID-19 cases and counting, the global public health messages are to stay home, practice good hygiene, and go to a health professional if you think you have symptoms. But how do you wash your hands with no clean water? Or social distance when there's 12 people in a room? And where will you get the money to visit a hospital if you fall ill? From Bangladesh to Venezuela, we take a look at how countries are dealing with the virus and how they'll cope with an expected rising number of cases. The United Nations says around 10% of the world's population live in extreme poverty. They're on less than $2 a day. Most people living below the poverty line belong to two regions, Southern Asia and Sub-Saharan Africa. And high poverty rates are often found in fragile and conflict-affected countries.
So I think one of the key issues that we need to think about when we're considering the impact of the coronavirus pandemic on countries which have lower GDPs or which are poorer countries, as it were, is that there is immense diversity and heterogeneity across these countries. The African continent alone has over 54 countries, and the diversity that we've seen across Europe and North America in terms of responses is paralleled in terms of the ways that African countries, countries of Asia, of Central America and South America and the Middle East have been responding to the pandemic.
In India, a country with a population of 1.3 billion, the number of recorded cases remains relatively low in comparison to China, Europe and the US, with over 20,000 recorded cases and around 700 deaths. But the true figures are likely to be much higher than official stats suggest. On the 24th of March, Indian Prime Minister Narendra Modi announced a nationwide lockdown for 21 days to stop the spread of coronavirus. Just 4 hours later, the country closed all shops, restaurants, factories, and told everyone to stay in their home except for essential travel. But the sudden and strict nature of the government lockdown left the country's migrant workers stranded, hundreds of miles away from their hometowns. They started to walk home, journeys that took days. In one incident, as they were trying to leave, authorities sprayed them with disinfectant. The WHO says while chemical disinfectants work on surfaces, they can be dangerous to people. The country's lockdown is now extended until May the 3rd. In neighbouring Bangladesh, millions of people rushed out of the capital Dhaka ahead of the country's shutdown. The government declared a 10-day national holiday instead of a national emergency to help combat COVID-19. Prime Minister Sheikh Hasina urged people not to panic and said her government was prepared to tackle the virus. The country has now reported over 100 deaths and around 3,000 COVID-19 cases. But a leaked memo from the United Nations showed that the coronavirus could kill 2 million in Bangladesh. The capital's largest slum, Karayal, has over 50,000 residents living in overcrowded conditions, with families cramped in single rooms. Experts have warned it may be hard to contain a spread of the illness in the densely populated region. World Bank data shows Bangladesh has 8 hospital beds for every 10,000 people, and the country's entire public health system has 432 ICU beds. The economic shutdown in Bangladesh is threatening livelihoods. The country is the second largest garment and textile producer after China. Since the outbreak, global brands cancelled £2.5 billion worth of orders with Bangladeshi manufacturers. Only a handful of firms have honoured their contracts. At the world's biggest refugee camp with over 1 million Rohingya Muslims who fled ethnic cleansing in Myanmar, the presence of coronavirus would be catastrophic. Many live 12 or more to a room, making it very easy for the virus to spread. The WHO's advice is to wash hands. World Bank figures show that less than 35% of Bangladeshis have access to hand-washing facilities. In Syria, there are 6.2 million people, including 2.5 million children, displaced. Devastated by years of war, many live in makeshift, overcrowded camps with little water and sanitation. The health minister confirmed the country's first COVID-19 death on the 29th of March. People in Damascus say prices of disinfectants and masks have skyrocketed in the capital, and panic buying has gripped shoppers. In the rebel-held northwest, no cases have been confirmed, but people have been showing possible symptoms. Years of fighting have destroyed the region's medical infrastructure. Over 500 medical facilities are gone because of the conflict. Only 3 hospitals give care for a total of more than 3.5 million people, and only 1 is fully functional.
دائما نحن مشفانا ناقص الاكسجين، في مرضى نحن بنحتاج لهم اكسجين وبنصير كثير بقى بنعاني مشان نريح مريض، نحرم مريض شوي من اكسجين نعطي لمريض ثاني.
Kenya has recorded more than 300 cases and fewer than 20 deaths. The government banned flights in and out of the capital, Nairobi, and enforced travel restrictions on 3 other coastal cities, and has a dusk to dawn curfew. 3 days before international flights were banned, 2,000 people were placed in forced quarantine as they arrived in Kenya. The quarantined Kenyans and foreigners make up some 80% of the country's coronavirus patients.
I am particularly concerned about the urban poor, and if there is no strategy for them, it will be impossible to lock them down. There is no way you can police a hungry person.
The East African country is home to 2 major refugee settlements, Kakuma in the northwest and Dadaab near the country's eastern border with Somalia. There were over 410,000 refugees in the country. As is the case in Syria, these camps are overcrowded, lack basic sanitation facilities and water supplies. South Africa seems to have acted faster than many other countries, using decades of experience battling infectious disease, shutting down their border and introducing a lockdown before their first death from COVID-19. But the country has been accused of having some of the harshest restrictions in the world. This includes no sales of alcohol, no dog walking, no leaving home except for essential trips, and prison or heavy fines for law breaking. They also started rolling out mass testing across the country. But the real battle lies when the healthcare system gets overwhelmed. They currently have the highest number of recorded cases on the African continent, and the World Health Organization say this infection rate is set to grow. South Africa also faces a HIV and tuberculosis epidemic. With lockdowns and reduced access to medical facilities, it's feared that those with HIV and TB will be neglected and vulnerable. While most people are complying with the lockdown, the government is worried that some continue to ignore the dangers posed by the virus.
We have to acknowledge that there are a huge problem in the context of many African settings, including in urban areas where people have to work in the informal sector of the economy. As you know, a very large proportion of the populations in African countries don't have formal employment. They are working in the informal sector, tiny businesses that require the business to be working on a day-to-day basis.
Meanwhile, in South America, Venezuela doesn't have a large amount of recorded cases, but the country faces a dilemma. Millions of refugees who fled the country because of the political conflict are now having to return home, and South America is expected to see a spike in infections. Despite the challenges, some countries are taking massive steps to make sure the spread is limited. Researchers in Senegal are trialling a new COVID-19 test, which can be done at home and costs $1. And others are preparing by introducing support measures. In Guinea, water and electricity bills will be covered for the next 3 months. Pharmacy prices will also be frozen. In Ghana, the government will cover all water bills for 3 months, and healthcare workers won't need to pay taxes for 3 months. Experts say Cuba has a strong testing and tracing record, as their national response since January has been a prevention campaign. For many years, they've offered free education for medical schools, meaning the country has a fair amount of trained staff who can respond to the pandemic. So much so that they've sent medics to Spain and Italy to help fight the virus.
Some of the doctors who were providing assistance to people affected by COVID-19 in the Middle East have themselves been educated and trained in Cuba. So here we see a low income or middle income country affected by the embargo, which has developed quite a strong national response, but is also internationally present.
But poverty isn't just felt in poorer countries. Many within richer societies are struggling too.
So, for example, we know that a country's level of GDP doesn't necessarily indicate how well or how badly it will respond to a crisis situation such as the COVID-19 pandemic.
In America, the state of Louisiana has become the South's epicenter of the virus outbreak. Nearly 25% of people live under the poverty line in New Orleans, where the death rate per capita is twice as high as New York City.
So poverty and poor health are inextricably linked, and many of our individuals in New Orleans are impacted not only by being low income, but by cycles of violence and trauma from early childhood. So all of this leads to the perfect conditions for chronic disease, and what we're learning about this virus is that it is opportunistic and that it is very deadly to people who have multiple organ disease.
Like in many other countries, medical staff are running low on personal protective equipment, particularly in rural hospitals. There have also been reports of medical staff facing pay cuts or having their hours reduced as hospitals lose money from non-COVID patients. What about in the UK? How will people living on the breadline be affected? We have the National Health Service, free at the point of use, which means access to medical care is not based on how much money you have. But the impact on the poorest will most likely be financial as more people lose their jobs. The Institute of Fiscal Studies, an independent think tank, says those from lower income backgrounds are 7 times more likely to work in sectors that are now shut down. That includes retail, transport, travel, food services, and childcare. The number of people applying for universal credit has risen 8-fold. So what can be done to help those in need during this global crisis? The international community is calling for help. $50 million of the United Nations Emergency Fund has been released so far. They want a £2 trillion emergency package to help struggling countries. One of their other recommendations was to freeze or cancel some debt for countries in distress. The UN said they did this post-World War II for Germany. The World Bank has also launched emergency support for some countries. They say they expect to deploy $160 billion over the next 15 months.
We obviously need to recognise that this is a global pandemic and that we need global solutions. We need solutions that are based on principles of solidarity, because we are only as strong as our weakest link, as it were. It's essential that we provide meaningful support to all communities on national but also on international levels.
COVID-19 is affecting the world, no matter who you are and where you come from. For poorer people in our global community, this is going to hit them the hardest. Washing your hands, social distancing, and going to a hospital can only be done if you have the resources to do so. And to help try to protect everyone from this virus, those who have the least money will need to be kept in mind with all the big decisions being made.